Welcome to the State of Mind Virtual Speaker Series. This series has been developed to provide education and support to youth, caregivers, and educators during this challenging time. This series is a collaboration between two local nonprofits, 1 in 5 and MindPeace, and various community mental health partners. We're glad you're here to educate yourself and to learn how to keep your brain in a healthy state of mind.
Hi, I'm Debbie Gingrich, Vice President of Best Point Behavioral Health by the Children's Home. As a parent, teacher, or other community adult concerned about our youth today, you may have some questions or concerns about teen substance use. You may have also heard that during the COVID pandemic, there's been an increase in substance use and mental health disorders, and you may be concerned about how this is showing itself in our youth. In this video, I'm going to share some information about teen substance use, getting the facts. I'll also share some warning signs that you can be on the lookout that might indicate your teen has a problem. I'll also share some key risk factors that may put a youth at increased risk for substance use disorders. And finally, we'll share some key tips and pointers for how you might best support youth during this time. First, let's talk about some facts of teen substance use. First, the good news is most teens aren't using drugs. There has been an increase during COVID. Early studies are showing that teens are more likely to use alcohol or marijuana since the pandemic began. Still, most kids are not using alcohol or other drugs. Electronic cigarettes are the most commonly used abused substance in our Southwest Ohio region at 13.7% of kids reporting use in the past 30 days. Followed closely by alcohol, 13% of kids reporting alcohol use and 10% reporting marijuana use. The average first age for substance use is 13 to 14 years old. And teen perception of harm is the lowest for marijuana and electronic cigarettes. So there are some risk factors that predispose youth to be more likely to use substances. The first is a family history of addiction. We know that kids who have a family history of substance use might be more prone to substance use themselves. The occurrence of another mental health disorder is also a predisposition for substance use. So if a child has anxiety, depression, or ADHD, for example, they might be more likely to try alcohol or drugs. And finally, the experience of an early trauma. This may be something like abuse or witnessing violence in the home or neighborhood, or being separated, early separation from a parent. Those kind of traumatic experiences also make teens more likely to experiment with drugs. A common question that we get from parents is, what kind of warning signs should I be looking out for to see if my child might be using drugs or alcohol? One of the first changes you may notice is changes in your child's mood. So they may become more withdrawn or depressed. They may seem less motivated to finish their schoolwork, to play with friends, do other things that they otherwise would enjoy. They may also become more quiet and secretive. You may notice that they're going up to their room and locking the door, or going in the bathroom and locking the door. You may also notice that they are having a hard time concentrating, or they may just be unusually hyperactive. Another way that you may notice changes in your child are changes in behavior. So you may notice that your child has started missing school or missing other activities. They may be avoiding eye contact with you. They may use gum or mints, perhaps to cover an odor on their breath. And they may use eye drops to relieve redness in their eyes. They may also be spending more money or maybe asking you for money. more than would be typical. And you also may notice periods of high energy and then crashing and excessive tiredness. All right, so what do parents and other adults do to help support teens? I think the most important thing parents can do is really share your family values and your expectations for kids about alcohol use and other drugs. You want to also make sure to include electronic cigarettes in that conversation. And you want to set rules and expectations for kids so they know what the expectation is for the family and what the rules are at your house. You also want to meet your child's friends and their friends' parents if possible. I always say it's a good idea if you encourage other children to hang out in your home, and you can intermittently pop in to see how they're going and meet their friends, know what kind of kids they're hanging out with. You also, as the adult in the home, want to model healthy behavior, like socializing, how to socialize without drinking alcohol. That's not to say you can never have an alcoholic drink, or if you are a smoker, you're going to need to be prepared to have that conversation with your child and let them know that you discourage smoking as an unhealthy behavior, and share your own experience of how difficult it is to stop. You also want to model healthy coping, like exercise and meditation. It's really important too to share your feelings with your child and encourage them to do the same. So if they're having a hard day, they're really stressed out, you can brainstorm together about how they might handle that stress or sadness or loneliness. And that helps them, as an adult, be able to manage when they have these difficult, intense feelings. You want to have open communication and really not just talking, but encouraging your child to share how they're feeling and really actively listening to what they have to say. You want to be sure to offer compassion and empathy over shaming and punishment. Sometimes as a parent, it's very hard when you're experiencing your own anger, frustration, disappointment. Maybe your child's made a poor choice. But you really do want to offer compassion to them and hear what they have to say. And then allow them to experience natural consequences. So, for example, if they got a poor grade on a test, maybe they went to a party the night before, instead of trying to ask for an extension, let them experience natural consequence, which is getting the poor grade. And these are just some strategies for how you can really support your child, help them build their ability to make healthy choices. Now I'm going to turn this over to Allie Rentschler and Claudia Thomas, two of our Best Point therapists who work with kids in our STAR program that uses the 7 challenges model for treating substance use.
Hi, I'm Claudia Thomas. I'm a licensed professional clinical counselor, and I'm here with Allie, my colleague, to talk about alcohol and drug use and youth.
And I'm Allie Rentschler. I am a licensed social worker and a behavioral health therapist here at the Children's Home. The pandemic has made it really difficult for kids to access resources that typically a school would provide outside of a pandemic. But being in a pandemic, it is very challenging for kids to have the structure that a school provides, have the resources that a school provides as well, and especially the extracurricular activities, and we're missing that big chunk of what the school structure and what the school system provides, which again is having a big impact on the increase of AOD use. I think with the increase in stress again and that lack of motivation these kids are having, it's something that when they feel isolated in their bedrooms, in their houses, they're, like Claudia mentioned, they're gonna find that access to drugs and alcohol. It can increase their negative thinking, increase their desire to want to go do something that they shouldn't do, which I think then plays back in the, what Claudia was saying, the decrease in drug and alcohol use is the pandemic, with the social distancing and the lack of social and peer involvement, can show a decrease in usage, but more so that isolation and that increased stress definitely has an impact on our kids and adolescents using more. With our youth and children and adolescents who are currently experiencing drug and alcohol problems, we are realizing that with the pandemic and the increased stress, they are more at risk for AOD usage. And again, because of the pandemic, we're noticing that there are several different barriers to them receiving the treatment that they need. We've noticed that the pandemic has prolonged the report process, prolonged the ability for these kids to receive the services and resources that a court would order for them.
Like court date, it keeps getting pushed back over and over again, and so they start to think, well, nothing's going to happen, so they keep doing the same behavior over and over again because there's no consequence. And so we're seeing that as a problem as well, because they're just feeling that they could do whatever and nothing's going to happen, and it's becoming dangerous for a lot of these kids.
So as a teacher or an adult or caregiver or parent, there are several signs and symptoms you can look out for your youth. Just to keep an eye out if you have concerns with AOD usage. And some of those signs and symptoms could be a increase in aggression, a change in mood and behavior that you wouldn't typically see from them on a normal basis.
Also, the Children's Home has a alcohol and drug use program for adolescents and youth. You can go to tchcincy.org to refer a child. There's a blue button in the top right corner that says refer a child. For our program is called 7 Challenges.
We have the 7 Challenges program here at the Children's Home, which is a non-abstinence-based model. And it really focuses on giving the adolescent or teen the ability to make decisions on their own. We realize that there are stages of change when it comes to drug and alcohol problems, and the 7 Challenges really focuses on allowing the client, the adolescents, to have the ability to speak for themselves, make the decisions for themselves, but also, as a therapist, help motivate them to change and move through the stages of change.
This is not an abstinence-based model. Like, these kids, if you tell them to stop using, they're not necessarily going to stop. Like, yes, there's things that could scare them into stopping. Some kids, like, there's drug tests, there's things out there, but this gives them the chance to take control of their lives, to make decisions for themselves, and they're not just doing something that they're told at this point. It's giving them that informed decision making, like, I made this choice for me, not for you, so that there's ultimately a better outcome.
A special thank you to our State of Mind speakers and to you for joining us. More videos and educational resources can be found at 1 in 5's website. If you feel like you or your child is in need of professional support, therapists are available. Please refer to MindPeace's school-based or community resource page. For a mental health crisis or emergencies, patients and families are encouraged to contact their current mental health provider first. This allows the mental health provider who knows your child best to provide support and direction. If your child does not have a mental health provider and they are experiencing a non-life-threatening mental health crisis, you are encouraged to contact the Psychiatric Intake Response Center at Cincinnati Children's Hospital Medical Center. 513-636-4124. Call 911 or go to the emergency department if you are experiencing a medical emergency, a life-threatening mental health crisis, or are directed to go there by a medical provider. This will help limit the spread of COVID-19 in our community and allow our emergency departments to care for patients with the most critical needs first.